I'm Jessica Stark. I am an assistant professor and physician at the UTHealth Neurosurgery Department at UTHealth Houston. I am here today to talk to you about minimally invasive spine surgery. We'll see as we kind of go through this what minimally invasive spine surgery is and why I think it's better for patients. The training is a little bit different for minimally invasive spine surgeons, so you do have to find a specialist like myself to perform these types of surgeries compared to the open spine surgeries. But as we go through this, you'll see why it's a little bit different and why I think it's actually a little bit better of an outcome and procedure for most patients. So what is minimally invasive spine surgery? Minimally invasive spine surgery is a surgical approach to spine pathology that can be used for stabilization of the vertebral bodies, for stabilization of the spine joints, or to relieve pressure that's being applied to the spinal nerves and the spinal column. This includes treatment for spinal instability, herniated discs, degenerative discs, fractures, traumas, spinal stenosis, and spinal deformity. How is MIS surgery done? To reach the spine during surgery, typically many layers have to be passed through and moved out of the way to perform the surgery. In open procedures, we typically make a very large incision and then dissect down and dissect the muscles away from the bones and spread the tissues away from the spine. In MIS surgery, one or more small incisions is made through the skin and then using a dilator to slowly dilate the tissue out of the way rather than cutting it or detaching it, we are able to put down with X-ray or other imaging technology a retractor or instrument to the spine. Once you're on the spine, then a microscope or endoscope is then used to be able to see through a small opening straight down to the spine with great visualization. What is the advantage of minimally invasive surgery? MIS approaches can be faster, they're safer sometimes, depending on the patient's anatomy, and they require less time to recover because we're not dissecting away and cutting through the muscles, we're just dilating them out of the way. This reduces the trauma to the muscles and the soft tissues. You get a better cosmetic result with a smaller skin incision. On the left, this picture here shows a kind of open surgery that we would do for, say, a microdystectomy. Whereas the picture on the right is a minimally invasive approach where the incision itself is less than an inch, usually on the realm of somewhere between 14 to 18 millimeters. With a smaller incision, we're going to lose less blood. We're going to have less trauma to the tissue, so less blood vessels are irritated. You have less avenue for infection to get into the body. There's less time typically under general anesthesia or local anesthesia only sometimes is used for these. And then all of this combined leads to a faster recovery with a shorter hospital stay and less pain medication use due to less trauma to the tissues. What types of surgery can we do minimally invasive? Well, dystectomy is one of the most common, where we work through a small opening and dilate the tissues out of the way and then put a retractor, like in this picture, a retractor down and clean out the disc. The other things you can do with this is using the same type of retractor, take off the bone over the nerves or the ligament and clean off the spinal nerves or the spinal column to clean out any pressure that's on the nerves. That's called the laminectomy or foraminotomy. We can also do, through minimally invasive approaches, fusions and interbody fusions. So making a small incision, we're able to put down a screw into the bone using imaging through a very small incision and not have to do a large open midline incision. So what exactly does all of this mean? So a dystectomy or spinal decompression. And this is an example of where we make a small incision and through sequential dilators, we place these down onto the spine, spreading the muscle, dilating that muscle rather than actually cutting them. And then we put a final tube in place. The microscope is then used, or an endoscope, to look down the tube and drill away or bite away any of the bone or ligament or disc that could be pushing on the nerve. So a cage can be put down the tube into the disc space for antibody fusions. When we do an interbody fusion, we perform the microdiscectomy, and then we bring in the x-ray, and we're able to place a cage into that cleaned out disc space now, all through the same small tube incision. When we remove the retractor, the muscles then go back into place, never having been cut. So a minimally invasive fusion. These are called percutaneous fusions, where we make small incisions on the skin. Multiple typical incisions are about 1.5 centimeters. And with that, we're able to put screws down and connect them with a rod. So we use an instrument to go through the small incision without cutting or dissecting the underlying muscle and get onto the bone. And then with x-ray or other imaging, we're able to place guide wires into the vertebral bodies and place the screws along the desired path over this guide wire. The rods are then placed through the screw heads through the same small incision and guided through each screw head. What are the risks of minimally invasive surgery? The same risks still apply as for open surgery when you're doing spine surgery. So nerve damage, infection, and blood clots. The risk of infection and blood clots, again, are much less with minimally invasive surgery because of the small nature of the incisions and the less trauma to the tissues. One thing that could be higher that we've seen is failure of the fusion, meaning a pseudoarthrosis. So in an open surgery, you have a large surface area that we go down and we're able to place bone graft on to allow for fusion. In minimally invasive surgery, since the incision is smaller, there is a little bit less surface area for that bone graft to go onto. So there is a slightly higher risk of failure of the fusion, though this is pretty minor. So outcomes. This is what everyone's kind of interested in, is what is the difference in how I wake up after this surgery? Studies have shown that the MIS techniques result in, again, shorter length of stay because there's less pain, there's less trauma to the tissues, there's less blood loss. So with less time in the operating room, the post-operative recovery typically goes much quicker. Surgical complication rate and success rate are relatively equivalent to open procedures. So whether you've had an open surgery or an MIS surgery, your outcomes are relatively the same and complications are relatively the same. The difference is the recovery and perioperative pain period that is much reduced with a minimally invasive surgery. On morbidly obese patients, oftentimes we have a little bit more difficulty doing these procedures open because there's so much tissue and so much depth to get down to the spine. Doing this through a tube, it doesn't matter how long that tube is. The surgical procedure is the same. You just dock the tube down, and whether you're using a 10 centimeter tube or a 2 centimeter tube, it doesn't change the way the surgery is performed. So it's a lot safer and easier access oftentimes for morbidly obese patients to get these done minimally invasive. This is our contact information for the UTHealth Houston Neuroscience Department. Again, this would be for any of our spine referrals, but also for our minimally invasive spine procedures. Thank you.